later. So with no further ado, Dr. Shik, do you want to go ahead and introduce yourself and get started on our topic? We have about 65 people on the call so far, with the numbers going up, so a few more people might join over the next few minutes.
All right, thank you. It would be a short presentation first. Hello, everyone. My name is Dr. Shik. I've been with Rockville Internal Medicine Group for 3.5 years now. I'm an internal medicine trained physician. I used to practice cardiology back in Ukraine more than 20 years ago. I'm a fellowship trained cardiologist. But I'm practicing internal medicine only over the last 25 years here in the US. All right, so I've been dealing with high blood pressure for my almost entire life. So let's start. I'll try to make it easy to understand the high blood pressure. Let's watch short movie first. It's a beautiful fall evening. The sun is setting. Dog finally stopped barking. Life is good. Inside, there's trouble brewing. Emma has no idea. Although she feels fine, like her father, Emma is one of the 67 million adults in the U.S. with high blood pressure or hypertension. Just like her radiator that's on the fritz, Emma's heart is working overtime to get the job done. Let's have a look. The heart is the pump in our bodies, delivering blood to the entire system through a set of pipes or blood vessels of all sizes. Smoking, high cholesterol, diabetes, obesity, physical inactivity, family history, and increased age all contribute to these blood vessels, or our pipes, becoming less elastic. The more blood our heart has to pump through stiff, narrowing arteries, the higher our blood pressure. The force of the blood against our artery walls is too high. Like threatening health problems can result. Problems like kidney disease, heart disease, stroke, heart attack.
Shik, the video quality on that was a little choppy, so you might want to give a little summary to people who may have cut in and out of the video during that.
Okay, I will do so. All right, so I will summarize basically how our body been regulated the blood pressure. You can imagine that it's a closed system, but the heart is a pump and it's squeezing blood out to our vessels. And basically, our body maintain normal blood ideally. So the blood pressure depends on power of the pump, how good the pump working. The blood pressure depends on the ability of our heart not only to squeeze the blood out, but also to relax. So it could be filled after that. So this is the short physiology update. It wouldn't be too long, promise. So the blood pressure relates to and has to do with the size and elasticity of our vessels. It also depends on how much hormones and different hormones we have, and multiple other factors. So what is normal? Universally been accepted that the blood pressure 120/80, universally accepted. If it's elevated above 120 to 129 systolic and diastolic above 80, that's considered to be slightly elevated blood pressure. We call it borderline hypertension, especially it's about 130 to 139. So why is it important to know all those physiology that I just talked about? That's important to understand how we treat the hypertension, what kind of action
we have to offer to you to treat it, and what kind of medication we have. So who should be screened? Pediatric guidelines varies. The last time I saw it was 13 years old. U.S. Preventive Task Force, that's the government organization that regulate and advise us on the screening, suggests 40 years old and then every 3 to 5 years. But in real life, every time you come into the physician, you will have blood pressure checked. Let's go to the next slide. So why it is important to be screened for the high blood pressure? How we know that the blood pressure causing major problem in our life. So in 1948, National Institute of Health and National Heart, Lung, and Blood Institute introduced so-called Framingham study. So Framingham is the small suburban city in Massachusetts with demographics close to suburban Washington, D.C. And they collected already, they collected data on 6,000 to 7,000 people and monitor those people now over 3 generations. The first batch of people was introduced in 1950s, then in 1990s, and now the third generation in early 2000s. So what did the Framingham study show? It showed that people with high blood pressure develop more cardiovascular events than general population. Events means strokes, heart attacks, kidney failure, cardiac arrhythmias, and some other bad thing that may happen with us. Also, it showed that high blood pressure is the independent risk factors for this major event in our lives. It's also identified several kind of population group that at risk, and they at risk for demographic reasons and for environmental reasons. So that's why the Framingham study is extremely important to understand why we check in blood pressure and we're treating people with high blood pressure. So how we make a diagnosis, how we know that this person needs to be treated, this person doesn't need to be treated, or we just warn the person or monitor the person. First is in the past. So in the past, blood pressure was checked during the office visit. Everyone realized at that time that it's not significantly reliable way to check blood pressure because people get anxious during the office visits. They drive in, they go through the traffic, they get in late, and the blood pressure gets elevated. We call it white coat syndrome. So the white coat syndrome is when your blood pressure pretty much normal at home, but elevated in the physician office. The opposite condition also exists when your blood pressure normal in the office, but elevated at home. So some anxious patients, they feel more secure in the office. So that's also might happen. But for the most part, white coat syndrome, as you know, much more relevant than muscular hypertension. So now that's a different story because blood pressure cuffs become more available, they become more reliable. We no longer need the stethoscope to check our blood pressure. And that's why home blood pressure monitoring or self-monitoring is the gold standard for monitoring blood pressure and adjusting your medication. We also use so-called ambulatory blood pressure monitoring. So basically, young individuals, young patients who have a borderline blood pressure, we have to monitor over 24 hours and see, is it really high blood pressure? Usually in the low side during the night or during the daytime. Well, those people not in the home. So this is the crucial decision for most of the young individuals to initiate treatment. That's why we do this ambulatory blood pressure monitoring. What does it mean? That means that we have a device that usual blood pressure cuff that's actually recording your blood pressure over 24 hours. It's not a pleasant, test, but sometimes we have to. All right, so we go to the next slide. So how we check the blood pressure? That's the several clues. First, do not exercise, drink coffee, or smoke cigarettes for 30 minutes before the test. Go to the bathroom before you checking your blood pressure. For at least 5 minutes before the test, sit in the chair and relax. Make sure your feet on the ground. Do not talk too much. Try to relax. During the test, you should uncover your arm for the cuff. Don't do it through your clothes. You have to rest your arm on the table, and it's better to do it in the morning, before your morning coffee and stress of the day. Also, do not use the wrist cuff. Wrist cuff, to go to your wrist, is not reliable at all. So right cuff size should go 1.5 times around your shoulder, and that would be your size of the cuff. Now we move to diet. So DASH diet. DASH diet is it stands for dietary approaches to stop hypertension. And it's include vegetables, fruits, whole grains, including fat-free or low-fat dairy products, fish, poultry, beans. This is the food group that's been advised by American Heart Association on DASH diet. Just a little cartoon. So this is an important slide to understand that not only the DASH diet itself, but the DASH diet with addition of the low sodium diet may improve independently your blood pressure. So this is the study done by National Institute of Health. They compare typical American diet or DASH diet with or without sodium restriction. What the study showed that both DASH diet and sodium diet help to control blood pressure. But if you do it together, that's significant improvement, especially those who on a high level of the blood pressure. So basically, the higher your blood pressure, the more beneficial dietary restriction would be. Now, most of my patients interested, what would be the symptoms of the blood pressure? Unfortunately, I'm not sure. I'm sorry. Fortunately or unfortunately, there is no major symptoms related to the blood pressure until we develop complications. So you can read the complications, all kind of aneurysm, kidney disease, eye damage, heart attack, and so forth. A lot of complications of the high blood pressure. So now I'd like to mention when you should call urgently reporting your blood pressure. So even though the high blood pressure is a silent condition, usually patients don't have any symptoms. Please always call us if your blood pressure high. That means above 180 systolic or above 115 diastolic. We have to know that, and then we're always glad to hear from you. Also, you should call us regardless of your blood pressure if you develop any of the following symptoms: chest pain, shortness of breath, palpitation, neurological problems such as weakness on one side, speech or swallowing problems. So we have to know whether or not your blood pressure elevated. Please call us or go to the emergency. You should call us urgently if you develop allergic reaction to one of the medication, or if you run out of medication. You don't have to wait. Just give us a few days before, but call us if you're running out of medications. So this is the current guidelines from Joint National Committee. That's a group of experts that give us a recommendation every few years how to treat, how to diagnose, and how to advise patient on the blood pressure. So if you're 60 and your blood pressure below 150 systolic and diastolic below 90, there's no need to be treated. You're still in the borderline hypertension range, so non-pharmacological therapy would be appropriate, but no pharmacological therapy advised if you 150 systolic. If you younger, less than 60, there's a different criteria and different goals. So this is a comparison on recommendation of blood pressure therapy by the same GNC committee. It's a committee, just a group of experts. The difference is that in the latest, it's a systematic review of randomized controlled trial compared to the previous recommendation that was non-systematic. And also, now we have a lifestyle work group that the JNC8 recommend lifestyle modification based on evidence-based recommendations from statistically approved recommendations, especially in a diet and exercise. So this is the list of the factors that contribute to elevated blood pressure. Stress, obviously, people with high blood pressure at the end of the day, hard work, anxiety at work or at home, they struggle, they have high blood pressure. People who do not sleep well, people who ignore recommendation and going to Burger King or any fast food restaurants, loading themselves with salt, they would have some problems. People with obesity, sleep apnea, people who drink a lot, they under risk. And they may require more and more pharmacological therapy, medications, unless they address these issues. So what can we offer to you? First, we have very attentive and experienced providers. We have very supportive staff who can address all your issues if you communicate with us. We always happy to see you in the office or communicate with you via portal, via virtual visits, any shape or form. We're always glad to address the issue. We have electrocardiogram, echocardiogram available in our office, laboratory evaluation to be done here. We do have an ambulatory blood pressure monitoring system that we can use. We have sleep medicine evaluation, beautiful sleep lab here, and very experienced sleep medicine physician. We have a dietitian and psychologist, so we always welcome here. So this is additional practical advice from me. I made this slide myself. So that's what I'd like to mention. That those guidelines that we just discussed about, it's not a substitute for the physician judgment. Every patient is different and require an individual approach to their problems. Again, communication is the key to succeed. Communication is the key to control your blood pressure in the proper way. So we'll always look for those modifiable risk factors that I just mentioned. Go back. So those factors, are they modifiable potentially? That's why to control blood pressure, we have to address all those issues. Also, we really want you to keep us updated with your medication list and all developments. Sometimes when you see the specialist cardiologist, endocrinologist, nephrologist, your medications has been changed, but we have to know that it's changed. Please let us know that it's changed. Also, when you come to see a physician, I'm not sure about my colleagues, but I always ask the patient to bring the blood pressure log of the past few weeks or months, so we can address your issue and correct your blood pressure in the right way. That's my last slide. All right, I'm done.
All right, thank you. So again, I'm Dr. Tano. I'm going to be just moderating some questions and answers. It looks like we don't have too many questions coming in yet, so feel free to start submitting those. You can submit to the QA tab, but also the chat, which reminder, the chat is public, the QA is private only. Dr. Shik and I are seeing the QA tab. So I'm going to give people 30 seconds if they want to come, if they have a question that they've been thinking about. Just quickly, we are open in the office. We are doing virtual visits. So if you have specific questions about your blood pressure routine or your blood pressure medications, we are happy to answer all those questions. I know a lot of times it gets confusing. In the last year, it's complicated by the fact that there have been some recalls of some of the blood pressure medications. So your medications may have been switched for something different. But we do have a question from one patient so far that came in over the chat. This is a more specific question about diet. Do gluten-free grains count as, quote, whole grains when related to blood pressure?
The answer is yes. But whether it has to do with the blood pressure, I'm not sure. I'm not any literature that suggests that the gluten-free diet affects.
Okay.
Have the answer to this question, but if the question, the gluten-free grains is the grains, it is a grain.
And then just
is that the question?
Yeah, are gluten-free grains the same? Do they have the same benefits as whole grains?
That's correct.
Okay, and then for some reason,
I want to add something. I didn't mention multiple other issues with the blood pressure, such as secondary hypertension. That means that the blood pressure related to other conditions, say, kidney disease or endocrine disease. I didn't mention anything about the group of medication that we use to control blood pressure. So that's why I keep these questions open. So if you have any questions, I'm happy.
Okay. So next, actually, if I could ask people if you could submit to that QA tab instead of the chat, it's a lot easier for me to read from the QA tab. But okay, so question coming in: what if you have high systolic blood pressure but low diastolic? So say you have, for example, 140/62. Is that good or bad?
Well, as long as your systolic blood pressure above the certain number, above 140, this is not normal, regardless of your diastolic blood pressure. So even though your diastolic blood pressure is normal, it doesn't mean you do not have a high blood pressure. Is that the question?
Yeah. And then what about the opposite? So sometimes, we see patients who have a systolic in the 130s, but then their diastolic is in the high 90s or low 100s. What would you say for those patients?
Technically, it is a hypertension, but the data on diastolic blood pressure is not as wide accepted as for the systolic blood pressure because the number itself is low. So those statistical research on diastolic blood pressure not as good as for systolic blood pressure. And most of the data, all those trial on medication or on diet and exercise done on and proven, statistically proven on systolic blood pressure.
Okay. What do you think about the recent recommendation about taking high blood pressure medication at night rather than in the morning?
I've heard about that, and as long as most of the medication that we use, it's a once a day medication and it's supposed to work for 24 hours, regardless when you take it. And it's also depends what kind of medication you take. For example, if you take beta blockers, it usually slow down the heart rate, and it's not really advisable to take it before you go to bed because usually heart rate slow at night. In terms of other medication, I would say if you take diuretics, I would not advise you to take diuretics at night for obvious reasons. Other than that, I didn't see any pros, any cons to take it at night. That's fine.
Do you mind, just some patients may not know the difference between a diuretic and a beta blocker.
The diuretic,
List which are the common beta blockers and which are the common diuretics.
the usual diuretics, that the medication that make us urinate more, so we can get rid of extra fluid in our body, and by this way, we get rid of sodium. That's why the blood pressure goes down. So that's diuretic is the medicine that make us urinate. So obviously, I would not advise to take it. So the beta blockers, that's the metoprolol, atenolol, the medicine that optimizing work of our heart, make our heart work more efficiently and slow down the heart rate. So it's okay to take those medicine if you have some other reason, and it's been proven that control blood pressure reasonably well. But if you take it later at night, it may slow down the heart.
Okay. How do we know if our home monitor is accurate?
Well, that's a very good question. Thank you. What you can do, you can bring your home monitor to our office. We compare your home monitor to our calibrated monitors several times, and if it's correspond, the numbers correspond, that suggests that your blood pressure monitor working properly. Also, I can add, nowadays it's very reliable data you can get for home monitoring, especially if you have a right size cuff and you do it properly. Also, what you can do, you can check it 2-3 times and take an average number and it also might help.
Here's another question. How high can blood pressure go up occasionally during stressful times or heavy exercise?
I put it this way, if you're exercising in the gym, the blood pressure will go up to 180, 200, but as soon as you stop exercising, it will come down to normal. This is not dangerous, and it's not require any further testing, as long as it's normal at rest. And one other question, if your blood pressure consistently elevated, that suggests that this issue should be addressed.
Okay, and then here's a similar question to exercise. A patient who says that I have high blood pressure, usually controlled by medication. When I exercise on the elliptical, my blood pressure drops suddenly when I stop to about 100/57. Why is that?
It depends what medication you take and how your fluid status arrange. If you are sweating a lot or you taking medication prior to your exercise session, may affect you negatively.
Okay, and then another question here about
Let me add one more thing.
yeah, sure.
Basically, try to hydrate yourself well before you go into the treadmill. Try to avoid taking blood pressure medicine before you exercise extensively. That would be my suggestion.
Okay. Why is the morning reading of blood pressure optimal and thus presumably more related to long-term risk?
Well, the answer is simple. If you're using caffeine in the morning, that means your blood pressure will be artificially higher after the morning coffee or tea. If you have a whole stressful day ahead of you, or you go to the gym, or you go to work, or you interact with people around you that may not be pleasant, your blood pressure may go up. So we do need to know what the baseline blood pressure is and make a decision about your treatment based only on your baseline blood pressure.
Okay. Here's another question. Can normal blood pressure vary from one person to another based on size? So I think this is probably related to height and like BMI, height and weight. Do you give more variance for blood pressure ranges?
I think that has to do how you measure it. So the people with the larger size may need a larger cuffs, and the reliability of the larger cuff is not as good as the normal size cuff. And the same applicable to very low weight individuals with the tiny arms. So absolutely, it's the blood pressure. The blood pressure, they may not change, but the way that we can check blood pressure, that can change.
Good point. Yeah, because we see a lot of times, young women will have these blood pressures of 90/50 when they come to the office. I wonder if it's just a cuff size problem.
Could be that, but it could be that's still normal because we don't have a definition of low blood pressure. We only have a high blood pressure. That means that whatever below the numbers, that below 120/80, is not considered to be a medical condition.
Here we have a question. I was diagnosed with labile hypertension. Can you elaborate on that condition?
Well, labile hypertension has to do with the stage 1 hypertension, not stage 2. That means we call it in the past borderline hypertension. So the treatment for that and suggestion for that is number one it should be taken seriously as the normal, the usual hypertension. Especially at times it goes above 150, above 160, it should be taken seriously, even though it's labile. Number two, how to deal with this? Again, diet, exercise, weight loss, sometimes yoga, meditation, acupuncture. You can use all non-pharmacological ways to control your blood pressure before you start taking any medicine. So other factors, whatever I presented before, should be addressed too. So basically, if it's a labile hypertension, it should be taken seriously. So as white coat syndrome and MOS hypertension. So basically, treatment of those conditions and monitoring blood pressure remain extremely important.
We're getting some really good questions here. So, is the wrist blood pressure cuff monitor less accurate than the one that goes around the upper arm?
Absolutely. It's ill-advised to use wrist. So I would not advise anybody to, it's because the reliability of this wrist cuff is very low.
Okay. Yeah, and then you had mentioned earlier, I just want to say that if you have any questions about your specific blood pressure machine at home, you can always bring it to the office and we'll compare it to the manual cuff that we have and tell you if it's accurate or not. How important is pulse?
Pulse is very important.
Yeah. Can you give ranges for people?
Well, the normal pulse is anywhere between 55, I would say 90, 95. That's considered to be normal. But if it's above those ranges, then we have to know why is it higher than normal. And there is a whole workup and a whole bunch of tests might need to be done to find out what the problem is. Also, it's important in terms of what kind of medication to use in patient with a high blood pressure. So if somebody with a very low heart rate, we would not use medicine that slow it down, and vice versa. People who have a very high rate, they will use the medicine that reduce the heart rate and the blood pressure.
Our next question, we've had a few of these. This could probably be a lecture on its own, so maybe just keep it to a brief answer so we can get to more questions. But could you explain the difference between a beta blocker, a calcium channel blocker, an ACE inhibitor, and a diuretic for controlling blood pressure?
Absolutely. Happy
classes of blood pressure medications.
Absolutely. Absolutely. So there's 5 major groups of medication that we use. One that's been used for a long, long time, it's called beta blockers. Those medicine reduce the heart rate and optimize the work of the heart. What they do, they reduce the amount of oxygen that heart needed to form. So by doing so, by reducing the heart rate and optimize the working job, heart job, we reduce the blood pressure and normalize it. So the next group of medicine is calcium channel blockers. What they do, they dilate the vessels, the really small vessels on periphery, capillaries, really small vessels. And once those vessels dilated, the heart able to pump more blood in the low pressure area. So by dilating the small vessels that facilitate the heart to pump blood more efficiently under low pressure. So the next group of the medicine that we use is the diuretic. We talked about it before. So you take the medicine that affect your kidney and make your kidney to eliminate water and most importantly, sodium. So once the sodium coming out of our system, it's pulling the water out and the efficient volume in our bloodstream getting less. So the heart able to pump blood more efficiently and easily and reduce the blood pressure. Is it a strong diuretic, a strong medication to reduce blood pressure? For the most part, no, but it's the treatment of choice, especially for African American, according to GNCA. This is the um, first group of medication that been advised to use, diuretics and calcium channel blockers for African American. That's what we have. So there is a other group of enzymes in our system that's called renin-aldosterone system. So basically, our liver produces the hormone or enzyme called aldosterone. The aldosterone is the um, liver enzyme that has to do with the sodium retention. So by blocking this enzyme, we're trying to get rid of extra sodium in our body, and by this means we're reducing the blood pressure. There's two other enzymes in the system. Those enzymes produce in both kidney and the liver. They call angiotensin receptors. So angiotensin receptors blocker, that's the group of medicine that include losartan, uh, Benicar or olmesartan, and others. And those medicine very effectively used to control our metabolism in the body, to control our blood pressure, our sodium and potassium metabolism. So other group of medicine called ACE inhibitors. So those example of those are enalapril, lisinopril, ramipril. Those medicine that act similarly, but it's old style of medicine. It's very still efficacious and widely used we widely use in our practice, and that's been advised to use by GNCH as well. Some other medicine we use to control blood pressure, if those five groups of medicine not, but it's all other groups on the back burner. We have to wait until those commonly used medication work. All right, so that's the update. Is any other? A lot of breath.
I know it's technical. This is why we all go to medical school. So I think this is probably our last question or series of questions that are sort of related, just so that we have time to wrap up and be available for our patients. But if you could speak, there's two parts to this. So one is if you could speak specifically to what we've been hearing in the news about ACE inhibitors, which would be like benazepril, lisinopril, enalapril, all the medications that end with pril, or about the risk of ACE inhibitors with COVID. And then also, if you could speak to why, if we know, why people with high blood pressure are at higher risk of complications from COVID.
Well, in terms of ACE inhibitors, I just read the up-to-date. There's no data suggests that we have to discontinue ACE inhibitors in patients who contracted the virus. There's no proven downside of continue taking it. So if you take ACE inhibitors, unless there was a huge news around the area, you should not stop the medicine. You should all the same. Vice versa. If you stop the medicine, your blood pressure will go up, and we have to substitute with it. It was unpredictable how the next medication will work. So the general advice from me personally, do not stop the ACE inhibitor. In terms of what other question was?
Why are people with high blood pressure at higher risk of complications from COVID?
Well, I haven't heard that they under higher risk, but if they have complication of the blood pressure, such as renal kidney problems or cardiac arrhythmias or heart disease, they would be under higher risk of complication. But high blood pressure itself, I have not heard that it's considered to be significant risk factor.
Okay, thank you. And then just one quick, a patient just wanted you to demonstrate at what level to hold your arm when you're checking a home blood pressure medication. You might need to stand up a little bit for this because you're kind of low on the screen, but how high up does that arm?
Basically, so I can put the camera down. Right. Well, basically, your arm should be rest on the table, and the angle between the elbow angle would be about 30 degrees, 30 to 45 degrees. Your shoulder should be on the 30 to 45 degrees. Oh, thank you. So I don't know how to. So that would be a proper angle to check the blood pressure. Also important to know that the blood pressure machine should be on the level of the shoulder. All right, thank you.
Okay, great. All right. Well, I think that's all we have time for in terms of questions. We did get a lot of questions, so we just unfortunately can't get through all of them. So that's just a reminder that as your primary care doctor, we are here during this time. We are happy to do virtual visits with you and go over some specific questions if you have questions about your medications. And then just again, we do have 4 webinars coming up next week. Every day except Thursday, you should have gotten an email from Privia about the links to those. If not, it should be coming out probably today. It's on a little bit of a delay for sending out. But again, thank you for tuning in. It's great to have you guys all participate. Thanks for the questions. Again, I'm sorry if we didn't get to your question, but we just
Thank you so much.
To. And thank you to Dr. Shik. Sorry. Dr. Shik did such a wonderful job, really went through some interesting guidelines and updated evidence there. So that's always great.
Thank you so much.
And have a great weekend.
Have a good one.